You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know about dental implants. If you are missing one tooth or all of your teeth, and especially if you have a loose-fitting denture, my advice, stick around for the latest edition of The Wellness Hour.
The Wellness Hour, an in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering dental implants. My first guest is an expert on the topic, Dr. Herman Kupeyan. Dr. Kupeyan, welcome to the program.
Randy, pleasure to be here. Thanks for inviting me.
Now, before we get into today's topic, tell me a little bit about your practice. By the way, one online. Beautiful, beautiful office.
Well, thank you. It took a long time to get it that way.
What kind of patients are you seeing?
Well, my patients are typically a young individual, perhaps missing only one tooth, or at the other end, a 90-year-old that's been wearing dentures for 50, 60 years and has a problem with it.
Why would a 90-year-old want dental implants?
To get their life back. You know, they're tired of having these dentures moving around in their mouth and their bone is melted away, and they've been going and getting relines and adjustments and relines and adjustments. And you know what? There's a better solution for them today.
So somebody as old as 90 years old can be
Absolutely.
a candidate.
You know, I had an 89-year-old that came in to me, said, Sonny, I go down south during the winter. All I have left is to go out to lunch with the ladies and play bridge. And she said, if I can't enjoy that, what's there left? She was a perfect candidate. Now, this 89-year-old lady, we gave her 5 implants in the lower jaw and gave her something that's totally non-removable. Unfortunately, she didn't have that much bone in the upper jaw, so we put 3 implants in there and clipped her existing denture onto it. Now, the lady has totally functional dentures without getting any sore spots. She doesn't have to go for periodic relines.
She's eating with the ladies now,
and she's eating and playing with the ladies.
What are the different categories of implant patients that you see?
Well, you got the young individual with a one tooth missing that's either congenitally missing or has trauma to it. You have people that are in between losing some teeth, you know, or have lost some teeth, or partial denture wearers. That's one category. Of course, we've got the total denture wearers. And the other category is those patients that go to the dentist and they've been told that their teeth have to go. So now their choice is whether they go through with dental implants or they get dentures.
Okay, now you say, and we talked on the telephone, you do it a little bit differently than it's done nationwide. That means you both do the surgery.
Correct.
And then you put the cap on top. And normally that's done by 2 different people.
Now, what makes it a little easier and better for our patients is that we also have one more thing, which is the in-house dental laboratory.
Okay.
So now we can do all 3 parts, and the patient isn't going from office to office today.
You say dental implant patients don't complain about pain. It's not a painful process. Hard to believe.
It is. And you know, with every case that I do, it's still difficult to believe how minimal discomfort that they suffer.
Do they fall out? I mean, they last as long as regular teeth, even longer than regular teeth?
Implants?
Yes.
Well, Randy, I've been doing them since early 80s.
All right.
And 98% of those implants are still in the mouth today. So I don't have a dental procedure that lasts that long.
So backing up for a moment, you have the person missing one tooth, then you have...
Yeah, and you have, people that are missing several teeth. Okay? And let me show you this case right here. Here's a young lady. Got some teeth missing.
Now, what am I looking at here?
Now, what you're
Full
looking
upper...
at there, hey, I'm a dentist, I look at teeth, okay?
Okay.
So what you're looking at there, you can see the upper gums,
yeah.
Okay? But the upper gums have melted away, it's shrunk in. They're on the inside of her lower teeth, okay? So the bone is literally melting away.
Was she wearing a denture?
And she's wearing a partial denture because she's got back teeth.
All
but
right.
the back teeth, you know what happens? As the bone melts away, the back teeth collapsed in. So all of a sudden, she's got no bite. And she's been going around, she can't find a solution to her needs. So her referring dentist sent her to me, and we came up with some options for her that would fit her needs. And this is the way we finished her off. And you take a look, we ended up putting on implants.
How many dental implants there?
There's about 7 dental implants there.
Very nice. I mean, they look real.
And you don't need a dental implant for every tooth.
Okay.
The misconception is you think you need a dental implant for every tooth that's missing.
You got to count your teeth.
Yeah, and then all of a sudden, people count their teeth and they go, oh, this is so expensive, I can't
So
do
on
it.
her, how many dental implants? Couple?
Well, on her, you got 7 dental implants, but we did 7 implants, we did 14 teeth.
And your lab right there makes these teeth because they look real, even though that's not an attractive photo, by the way. to us, maybe to a dentist,
Hey,
but the teeth look beautiful.
I want to tell you, a dentist would fall in love with that.
Okay.
Okay. So with the dental lab being right in-house, okay, we can really, work at that, going the extra mile and trying to work at that extra cosmetics, giving them, the extra service. So there's no going and coming. Everything's done under one roof.
You say you're changing people's lives.
Absolutely. Let me show you an example.
Okay.
Here's an individual that's in his mid-50s. He's been walking around because there are no options for him.
But a case like this, is it common to see teeth in that bad of shape?
Yes, and you don't see it because they never smile. I'll tell you another story with these individuals that have been burdened with a cleft palate situation.
Okay.
When implants first came out, I had this individual, 65 years old, had basically dentures, had never been treated. So we offered him the option of implants. And I'll tell you something, till the day that he died, he couldn't stop thanking me because that was the happiest he had been. He sold his business and he retired and he enjoyed the rest of his life. And that's what implants can afford these patients. Now, take a look at this patient. He was basically in the same dire needs, and that's him smiling. And look
Huge
how natural,
difference.
Huge difference. Look how natural it looks. They're all one color. They all look like teeth. It follows the lip line.
So his option would have been an upper denture.
Upper denture. And even with an upper denture, how is it going to stay in the smell?
Now, what does he say to you when it's all done? I mean, when he sees himself in the mirror, I mean, you get tears, they get emotional.
Does he ever get emotional? You know what he says? Anytime you have any of these individuals, you tell them to talk to me, and I'll tell them why they should be doing this treatment.
What about pain for this guy?
This individual didn't even complain about pain. Pain is a thing of the past.
Do some people say I had no pain?
That is correct. The majority of them, that's what they say. For this particular patient, we put 4 implants in and made caps over them, capped the other teeth, and now you can see the results.
What if somebody is losing their teeth because their gums are bad? I heard this the other day. They said
that
my
happens.
gums are too bad.
Daily. Yeah, absolutely. And you know what? They don't have to go without teeth. We can take those teeth out, put implants in, and give them some permanently fixed teeth.
But if they have bad gums, like periodontal disease?
Once you get rid of the teeth, the gum infection's gone. Unless there's a very serious infection.
Okay, interesting.
Okay, we clean everything up, put the implants in, and usually what we do is give them these provisionals, which they wear till they're healing, and they're permanently fixed in there.
Okay.
They're non-removable. So they're accustomed to the same comfort that they had with their periodontally involved teeth. Now, let me show you this case here.
All right.
This is an individual that had the same similarity to what we were just talking about. Okay, he had a denture, and he was told those teeth are periodontally involved. Now, here's a guy, a businessman, a very prominent businessman, and he's got pus around his teeth. And as you can see, we took out those periodontally involved teeth, put implants, and did the teeth in an hour procedure on him in the upper jaw.
Teeth in an hour?
Teeth in an hour, okay. We took out teeth, put the implants in, and then put teeth on there right away. And this is how he ended up. Those are non-removable, upper and lower, implant retained teeth.
So he would have had dentures?
He would have had dentures. He had no alternative.
Now he has a world-class smile.
He's got a world-class smile. And let me tell you something, not only a beautiful smile, a lot more confidence, because he has no issues with standing in front of a lot of people and projecting himself.
So before he just hid his teeth, didn't smile?
He didn't smile whatsoever. We did not see any teeth. He never showed any teeth. Even if his wife is saying that he shows teeth now.
That's a world-class smile. I mean, it looks good.
It does, but not only that, just look at it. You think with what he had before, you think he could eat well? With those teeth, he's got pus in his mouth around those teeth. You think he'd get close to people? He would have bad breath all the time. So now, at least he's got some confidence.
So he has full upper and lower teeth.
He's got full upper and lower teeth.
How many implants for a person like this?
He's got
you have to take them all out, right?
We took the teeth out,
put
the implants in, and made provisional teeth for him that day.
Do they snap in and out?
No. They screw in. They stay in there all the time.
Do they feel like it's regular teeth, by the way, that they say?
Most people, that's what they tell us. It's close to natural as you're going to get, because they're in there all the time. They don't come in and out.
How soon could a guy like this eat?
He can eat right away. As soon as he feels comfortable, he can eat right away. Again, when we put implants in immediately, they need to go on a soft diet for a short period of time.
So in Detroit, where you are, and Canada, I mean, there's millions of people, I guess, or close to a million that are wearing dentures. And you're saying in most cases, 4 dental implants they could have something that stays in their mouth.
Absolutely.
Why aren't they all doing it though? I mean, I asked you that before. They just don't know?
They just don't know. They just don't know, and they're not being offered that option.
They're afraid of the dentist.
They're afraid of the option of the dentist, or they don't know their options.
Okay, we're going to take a quick break. We come back, more about what you can do for the denture patient, their options, and also the process, what people could expect on day one. You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know about dental implants. We'll be right back.
I have, for how many years, since I was 27 years old, had this fantasy that I could maybe grow new teeth or have teeth in my mouth that I wouldn't have to take out to clean, to be confident when I smile and chew. Today for me is like my wedding day, like the day I held my newborn daughter in my arms. Today is like a milestone for me that I can actually have teeth in my mouth that I don't have to take out. I feel like I'm whole because I have teeth in my mouth.
There was many times when I had to hide in the bathrooms to eat, where now I can eat anything, I can smile, and I feel so much younger. And the worst fear I had was to have him say, "We can't do anything for you." I knew this was for me, I was worth it, I'm still worth it. Here I am, I can open my mouth now, and I'm happy. But I wasn't just a patient, I was a person that they were trying to give a perfect smile to. I must say, it's been all worth it.
You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering dental implants. My guest here is Dr. Kupeyan. Okay. Now, the denture wear specifically, what are their options?
Well, they've got quite a few options, and depending on where they want to go. Now, let's take the lower jaw. Lower denture.
And the lower is always looser.
Oh, that's the worst, and that's what everybody
Why is that?
complains
Why
about.
is that? Just the jaw moves?
Yeah, and the bone melts away a lot quicker. Okay, and there's no palate. Like in the top, you've got that roof of the mouth, so you got more bulk.
Like a little suction.
You got more suction. So in the lower, there's less suction.
Okay.
Okay. Now, the quickest way to start off with the lower jaw is, let's say we put 2 implants. What that does for the patient is it makes the implants a little bit more secure. So they're not.
What snaps?
They snap in, and however, they still tilt and they still rock, so they could still get.
But it's
sore
still
spots.
better than what they were doing.
It's still better than what they've got. Okay, it's a good option. Okay, but there are better options. So if they could go 2 more implants, then they could have something that's screwed in there that doesn't move. They'll never get sore gums again.
So 4 implants. You're calling this all on 4?
That's the all on 4 technique with 4 implants. Now, what the unique thing is, okay, with the back implants, they're tilted, and because they're tilted, they're able to put up with the forces, and we're able to put more teeth on them. And this has come to the limelight within the last few years.
Okay.
And everybody thinks it's a new procedure. It's been around.
I mean, you've been doing it for a while.
But we've been doing permanently fixed teeth on implants for 10, 15 years now.
You say this is the happiest group of patients.
Oh, they're ecstatic. You know why? Because they come in, they're so debilitated, and they have so many problems that to give them something that's permanently fixed, and they're able to chew and digest their foods and get out in the public without having to worry about putting glue in their denture.
So they have to be surprised. I mean, that they go in on a consult that they could do with just 4. Something permanent.
Let me give you an example.
Okay.
This lady that we did with 4 implants, she had this done back in 1998.
Okay.
Okay. She was 85 years old at that time. Okay. She just came back 2 years ago. She was so happy with what we did, and I think she got remarried at that age.
All right.
And then she wanted to get the uppers done. So what we did was we put 4 implants in the upper jaw and made permanently fixed teeth in the upper jaw.
So now she's in her 90s, she comes back and she wants more implants for the upper. Seems like she wouldn't want to go through that again, the pain.
But the first time that she went through it, she didn't experience that much discomfort. And it was worth it for her to go through it. You know, she's married now, she's going out more, she's more sociable. And
why did they become more social? You say these denture wearers, they get dental implants, something secure, now they're more social.
They have a lot more confidence. You don't have to take that denture out, put all sorts of goop in there, and to glue it back on when you're going out to a restaurant. So they feel a lot better about themselves, and they feel a lot more secure having teeth that's in there, and their smile is rebuilt.
So is this one of those things where they say, boy, Doc, I wish I would have done this years ago?
Absolutely. I had this lady that we did in 1985, and she moved down to Florida. She came back to visit. She came to see me specifically, and she said, you know, you did something for me that you don't even know. I said, tell me about it.
Okay.
And she said, you know, I was on all these stomach medications since I had my implants done and had permanently fixed teeth. I've been off on all medication for my stomach. So
why is that?
Because she couldn't chew. She was swallowing her food whole. She couldn't digest.
Is that common? Is that common?
I'm sure it's common. But if this lady didn't tell me, I wouldn't know. No, it's not a thing that we go in there and ask them, are you having trouble with your stomach?
All right.
It was an amazing thing for her. And imagine, she came back just to tell me that.
What if somebody has osteoporosis?
Man, that's a great question. You know, with this 3D software, we can actually see what the density of the bone is, you know, and as long as the density is there, I feel very comfortable putting in the dental implants. Now, there's severe situations like there are medications or so, you know, we need to...
But most 70, 80-year-olds are on medications. Can they still get dental implants?
You know what, normally the 70, 80-year-old is on normal medications that we can deal with. And I'm talking about if they had a cancer or chemotherapy or anything
those
like that,
problems, okay.
And, you know, extensive problems, we consult with their physician, we work with their physicians and do it within the regular guidelines.
Now, I've looked at your before and afters, and you are making these teeth look not like dentures. They're good looking, and you know, our program airs nationwide. You're not the first dentist we've had talking about this topic, but these are the best before and afters. Being a prosthodontist, because we didn't talk about that. What is your role? I mean, by definition, what does a prosthodontist do? What is your specialty?
Well, you know, prosthodontists are trained. They go back to school for another 3 years. So they're not only dentists, but they go back and they specialize. And they specialize learning how to reconstruct or put together the lost components of the face and the jaws.
You say with these denture wearers that they're just losing bone and their face sinks in, because I feel like I could spot a denture wearer.
Oh, absolutely, because you know, the jaw, you can see the older ladies where their chin reaches their nose, okay. And that's either the dentures are wearing out or the bone is melting away, and that's how you tell. So what we're doing is we're bringing back that natural appearance.
So is it the force of the implant that keeps the bone from dissolving? What is it?
The implant acts just like a natural root. Okay, when you have your natural teeth and there's no gum disease or anything like that, what it does, it preserves the bone. It stimulates the bone, gives you perception, gives you that feel. Okay, but when you lose the tooth, all that feel is gone. And you got a denture, and the denture sits on the gums, and there isn't that much perception. Well, now what we do with the implants is replace that natural tooth with an artificial tooth, which is the implant.
What about the upper denture wearer? What do you say to them?
Well, what I say, the best thing is, I don't have to say anything.
But aren't they secure, though, the upper denture? You don't really need...
Well, they are, but let me give you an example. Okay, let's say that patient comes in and has some implants on the bottom, has permanently fixed teeth. All of a sudden, the upper denture doesn't feel so secure anymore.
Oh, is that right? You hear that?
Yeah, and the other thing with the upper denture is, hey, the roof of the mouth is covered. They can't taste their food. So we put some implants in there and give them some permanently fixed teeth. Now the palate's not covered anymore.
Does the upper require more dental implants to secure it than the
Randy, that's a great question. Yes, it does. And let me describe it this way. The bone in the upper jaw is much softer than the bone in the lower jaw.
All right.
So,
well, how many?
If they've got enough bone, you can do 4.
All right.
But if they don't have enough bone, you have to do 6 or 8.
So even if somebody has been in dentures 30, 40 years, one way or another, you could find enough bone to do it without
Randy, with the software,
hips.
with this 3D software technology, we can probably find the bone.
Okay.
Okay, it's there. If we can find it, they have it, we can find it, we can put implants in.
Will this eliminate dentures someday, in your opinion, dental implants?
I hope so. Dentures are a bad thing to do for patients.
Okay.
That's my opinion.
You feel strong about that?
Oh, yeah, I feel that.
Is there a happy denture wearer out there?
There may be, but I don't
My father also has dentures, by the way. Both parents. My teeth are fine. But he says, for the most part, my teeth are pretty good. I mean, I'm fine with my denture.
You know what?
They don't know what they're missing?
They don't know what they're missing. The human body's great. They accommodate to anything.
They don't go to the dentist, you say, the denture wearers, for the most part.
Well, most of it. When you get your teeth out and you have dentures, what's there to, why go to the dentist?
Okay.
So that's the...
So nobody's telling them to do it?
No one's telling them to do it. If they went to their dentist or they went to a dentist, you know, they may get some of these options, and they could find out what they've been missing.
Now, on day one, when they go in for a consult, by the way, do you meet with the patients?
Absolutely.
Okay, what do they want to know? I mean, what are the standard questions you hear
Does
all
it
the time?
hurt?
Does it hurt? Okay.
And I'm scared.
What do they say? What do you say when they say, does it
The
hurt?
best thing that I can say is, would you like to talk to other patients that have had it done?
And they say it's, and you only give them like a Motrin, or what do you give them, by the way, to
Motrin.
take home?
I mean, you know, afterwards. Now, you know, there are some patients that you need more, okay,
Right.
but it's only for one day, so it's not an extensive amount of discomfort. It's very minimal discomfort.
So the first thing they say on the consult, does it hurt? What else? Do they say I'm too old? What do they say?
Well, I'm too old is always a thing. I'm too old to get this. Do I need to spend all this money on myself? And I go, hey, you know what? You have to determine what is best for you. That's why we sit there, try to listen to them, and try to come up with a solution.
But you're a dentist. I mean, of course you think the teeth are one of the most important things, right?
Well, absolutely. And you know what? You know, when I take a look at the health of the individuals, who are those individuals that live the longest and enjoy their life? Individuals with teeth, or teeth that don't come in and out, and they can eat what they want. They're more active. You know, they
smile
do what
more,
they want to do. They
obviously.
smile more. They travel more. They're the ones enjoying life.
Okay, okay.
Let me show you a few more
All right,
photos.
all right.
All right. Here's a young individual, 18 years old, young gentleman having congenitally missing teeth that never came in.
Okay.
Now we can put in some implants and make them look natural. You can't even tell that.
So his options before would be something that snaps in and
Oh
out or
yeah,
something.
absolutely. That was the only option that he had.
Like a flipper or
or cut
whatever
down
you
the
call
other
it.
teeth.
Okay.
Cut down these beautiful teeth to put a bridge in there. Wouldn't you rather have a simple
Yeah.
implant in there? Don't touch the others. Look how gorgeous this turns out. Let me share another one for you. This is one of my favorites, and I was telling you about our accident cases. Here's a 21-year-old young lady, great-looking lady, and she falls off her bicycle, and she loses her 4 front teeth.
Wow.
And you know, the options here are not very good, because if she gets a partial denture here, that bone is going to continue to melt away. And she's
So the rest of her mouth, what, collapses?
And the rest of the mouth is going to collapse. And when she's 40, 50 years old, she's going to have that collapsed look and maybe lose some of those other teeth because they weren't supported properly.
So this is an 18-year-old girl somewhere.
This 21-year-old girl.
21, okay.
21. The best option for her was to do dental implants, and that's what we did. And with the dental implants, you can see how we
Beautiful
can restore.
job here.
Yeah, and you can see how
They
it
look
follows
real.
the lip. That's what we're in the business of doing.
I mean, that's a pretty, you know, it's like a sexy smile. And now it looked like a hockey player before, without being too
Absolutely.
insensitive here. And that's, how long? I mean, what's the recovery time?
That was done with the, again, the teeth in an hour concept. However, the teeth weren't put in right away because of her active schedule.
Okay.
Okay? So,
So she went out of there without teeth, though. I mean, she had
well,
teeth.
you know, they never walk out of there without teeth.
All right.
We always give them something to wear.
Some kind of temporary.
Yeah, some form of temporary.
So
Whether
tooth in
it's
an
a
hour,
snap-on-
teeth in a day? What do you call it? Is it gimmicky? I mean, you can really do that.
No. It literally, they're both done depending on the patient's needs. They walk out of there the same day, you know, with teeth. So one procedure expedites things.
All right.
We can do that in an hour, and the other procedure takes a couple of hours.
Final message to people that are afraid or they're skeptical that with 4 implants you could secure, you know, give them something fixed in their mouth that they don't have to take out.
There's a solution to your needs. You know, see a dental professional
Okay.
and find out your options.
So ask your dentist.
Ask your dentist, and don't ever be afraid to seek another opinion.
Now, is it more expensive to go to a specialist like you for dental implants?
Randy,
prosthodontics?
that's a great question. But when you take a look at all things being equal, you know what? At the end,
So it's
it
about
costs
the
about the same.
So go to somebody. So look for a dentist then that this is what they do,
Correct.
and that they've been doing it for a while.
Those are great questions to ask. How long they've been doing it for, you know, what their experience is. Those are wonderful questions.
These procedures, by the way, where do you do the surgery?
We do it in our own facility because part of our facility is accredited as a hospital.
Is that right?
Yeah, so that's the beautiful thing about this office, that we do have a certain segment of the office that's totally dedicated to implant surgery.
What about sedation, things like that? Somebody that's completely afraid of the dentist.
Oh, we've got an in-house medical anesthetist
Okay.
that we can either just sedate them or completely put them to sleep.
Is that popular, by the way? People that just want to be completely out for the...
You know, not completely out. We just give them a little bit of sedation, and we can do it under regular sedation. Okay, that's not.
So it's not even necessary. So they're awake when they're getting the dental implants?
You know,
no
the
pain?
majority of my patients are under local anesthetic. They don't need sedation. The only time we use sedation is because of their past fears.
The part I don't get is why is there no pain? I mean, you're putting in these dental implants and it doesn't hurt. Obviously they're numb, but...
They're not. The reason that they're not hurting is we're putting into the implants into bone, and there's less nerves in the bone. Most of the proprioception comes from the gum tissues. And with this new method, we're not cutting the gums, we're punching and going right through the gums.
Interesting, okay.
So there's no big cuts. And when you don't make big cuts, there's less discomfort.
All right, very good, by the way. Thank you for coming on the show. Learned
Randy,
a lot
I appreciate
today.
you having me here.
All
Thank
of
you.
this is on your website.
That's
They want to
all on
learn
my
more.
website. You can visit it and get more information if you require it.
All right, thanks for coming in. You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview online again or direct a friend that is wearing a loose denture, right? You can visit wellnesshour.com. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.